The Congress is all about advancing health equity and asking the question, how can we build a fairer future? How can we create cities that are healthier and more sustainable?
It's interesting thinking about the economic value of healthy places, because the first thing to do is think about the alternative, the economic weakness or poverty of places that aren't healthy. And we all know things like a lack of exercise, a bad diet, poor air quality, water quality, all of the things that some people take for granted, but other people just don't have access to. And that is why I think it's really important to address this issue around equity and the sort of inequalities that exist within the built environment. We've seen that from the speakers today with some really shocking statistics. But also what we can do to address that, and how with the right kind of investment that's being called impact investment, we can make things change for the better for the majority of people, rather than just entrenching these inequalities that we all know are there, but not as sure about what we can do about it.
We'll be talking about why every city planning decision should be refracted through the lens of public health, and why we need impact investment on the ground so that we can move from the theory of the healthy city to the practice of the healthy city. We're in the city of Liverpool, which is actually getting spades in the ground and is doing stuff. They are looking at how they develop and plan the future city of Liverpool through the lens of health, and particularly through the lens of health equity.
So when you think about why poor health is bad for us all, obviously really bad on a personal level, and it's simply unfair and not just that some people in our communities live worse lives than others. But actually there's other reasons why having good health is really important. So the cost to the health and social care system of poor health is immense. And we know that here in Liverpool, poor health costs the health and social care system around £1.9 billion a year. And then if you think about the economic impact of that, if you have people who are unwell and unable to be working, then that has a direct impact on productivity and on healthy economic growth.
I think it's really important to have health at the centre of all of this. I mean, when we talk about economic drivers, productivity, where the country is going nationally, we are, affected by some of the health outcomes that people have and determinants. So it's got to be part of an all-in approach in terms of how we do development. We can do straight up development and forget about it, or we can do what I would say regeneration, where you're looking at social, physical, economic inclusion with health as part of that. How do we, at every stage of development, look through the lens and say, can we do that bit more? And that's the conversation that we're getting into with development, with real estate, with our partners, because we need to change the outcomes of people in the city. And when we talk about growth, it's got to be good growth.
Everything needs to be joined up, it needs to be coordinated. And that's quite a difficult challenge. The healthy city, has got to connect all these different and disparate players, but the commercial real estate community is right at the centre of this. And from some of the things that have been happening in Liverpool, they are grasping those opportunities and they're looking for more opportunities in the future.
In the past, the finance minister would sit right next to the prime minister in an emerging economy. Now we're finding the health minister needs to be brought up from the far end of the table, because emergency preparedness, climate change, and the environmental implications of health are all critical things that drive economic viability. And so communities, families are integral in national environments.
When I started my role as chair of the High Street Task Force, somebody asked me what success would look like. And I said, it's when we stop judging high streets purely in terms of retail. And one of the ways we're going to change what high streets are all about is by making health provision central to every high street. There is an investable opportunity. Not only do, being frank, health provision take nice long leases, which are rare on the high street. In addition to that, we have a problem with lack of occupiers on the high street and lack of vitality. And if you're bringing people to a town centre to benefit their health, whilst they're there, they're going to do other things. They're going to socialise, they're going to have a cup of tea, they're going to do a bit of shopping.
Too often, things are cut out of urban plans or neighbourhood housing and so on, because people are taking a short-term investment view. We need to take a longer term view.
Institutional investors like Legal & General have hundreds of thousands of people we're here in Liverpool, about 200,000 people in Liverpool will have entrusted their pensions and savings to Legal & General. So it's more a question of how would you tackle health inequality without those pensions and savings being brought to bear. So part of the reason we're here and we spend time with local and combined authorities and community initiatives is because we're stewarding those hundreds and thousands of people's pensions, and our role is to invest those back into the city in a way that has a positive impact on those people's lives, but also generates superior financial returns as well. And we actually think if we can get that right, we can achieve both, because we understand the need for investment and we create assets that meet that social need.
I think the value of these types of conferences, where you are bringing together people from different worlds who wouldn't normally be having these discussions, is what happens next. And relationships are made, new knowledge is transferred from one organisation to another. And as we've seen earlier from a collaboration between Legal & General, the UCL Institute for Health Equity and Quality of Life Foundation, is that genuine partnerships are formed at these events. And this time next year, who knows what we'll be coming back to hear about, because of conversations, meetings that have sparked ideas that then turn into something that can help with this movement. Because I think that's what everyone here is wanting to do, is to be part of a movement that really starts to prioritise health within our cities and within our communities.